How to avoid mistargeting. Accurate ablation is essential to achieve optimal ablation zone with sufficient ablative margin around the index tumor. For accurate ablation, we need to accurately place the electrode exactly at the site as planned. If we inaccurately place the electrode, the ablation zone may be different from that of expected ablation zone at the time of planning. It can result in complete tumor ablation without sufficient ablative margin, or even incomplete tumor ablation with residual tumor. The worst scenario of inaccurate ablation is mistargeting. Mistargeting is defined if the ablation zone was formed at the wrong site around index tumor. Most frequent cause of mistargeting, the initial conspicuity of tumor at the smaller tumor size. The mistargeting seems to be encountered mostly in ultrasound-guided ablation. There are several tips to avoid or manage mistargeting in liver ablation. First, careful selection. If a tumor conspicuity is very low, even after using fusion or contrast-enhanced ultrasound, or the tumor size is less than 1 cm, potential of mistargeting could be increased. However, there is no consensus on inclusion criteria according to the degree of conspicuity because the conspicuity is very subjective and therefore shows broader spectrum. As the worst scenario, we can experience the unexpected mistargeting if any adjacent cirrhosis-related nodule adjacent to the index tumor is more conspicuous compared to the index tumor. So, careful confirmation of the exact index tumor on planning ultrasound with fusion and/or contrast-enhanced ultrasound is very important to avoid the mistargeting. For those inconspicuous tumors, at planning phase, we have three potential options. First, try to ablate with all assistant techniques, including fusion, contrast-enhanced ultrasound, and artificial ascites. Second, close follow-up until the conspicuity clearly increased to guarantee accurate and optimal ablation. Third, refer to alternative treatment modality, including TACE or TACE plus ablation or radiation therapy. The final decision should be made after considering the various clinical conditions and the patient's anxiety for the viable tumor or any specific treatment technique. Second, careful ablation. If we decide to ablate, we should be more careful to place the electrode and monitor ablation zone during the ablation. Don't forget the tumor conspicuity after inserting the electrode is progressively worsening as the electrode is approaching close to the inconspicuous tumor due to ultrasound artifact from the electrode tip. In addition, respiration is also an important hurdle for accurate placement of electrode into or adjacent to the tumor. So, if the tumor is only visible at fully inspirated state, we should be more careful to pull back from the index tumor even after accurate placement initially. Third, careful finishing. Almost all mistargeting arises from missing the final opportunity to avoid the event. The reason to encounter the mistargeting is that we usually to assess the optimal and accurate ablation on the poor Sony window immediately after the ablation. So I would recommend to carefully evaluate ablation zone after echogenic ablation zone disappeared completely. Additional registration of fusion image should be carefully performed and check the index tumor and hypoechoic ablation zone with hyperechoic rim. If the ablation zone is quite off the GPS marker of index tumor, carefully reconsider whether the mistargeting happens. In some cases, we can see the index tumor adjacent to ablation zone. Additional contrast-enhanced ultrasound can be a good tool to confirm the unablated index tumor. Finally, how to manage the mistargeting in liver ablation. If the mistargeting was found an immediate imaging study, we should carefully reassess the course of mistargeting with careful review of the whole steps of ablation. Reconsider if you can do with a different way, avoiding the determined course or not. Reevaluate the tumor and ablation zone with fusion and/or contrast-enhanced ultrasound and check the possibility of accurately achieving the complete ablation with reablation. More careful ablation and careful finishing are still essential to guarantee the final technical success. In summary, mistargeting can be minimized by careful selection, precise placement of electrode, careful monitoring, and final assessment before finishing. Thank you very much.